Okay, moving on to questions to the Minister of Health. Question 1 has been withdrawn. I call Mr. Frew, Paul Frew.
Thank you, Mr. Speaker. Each trust will have its own operating model in how they manage patients with delirium, whether this be in the hospital, independent sector or intermediate care. It means trusts may not have specific designated delirium beds, but all will manage delirium patients or other patients with challenging behaviours. Those trusts which have confirmed they have specific delirium beds are Belfast, South Eastern and Northern. Belfast has a contract for 12, all allocated within an independent sector care home. These provide essential support for patients requiring specialist care in a non-acute setting. Moving to South Eastern, they have 10 block-book delirium beds, also situated in an independent sector care home within its area. These beds are currently fully occupied, reflecting high demand. For the Northern Trust, there are 6 beds at residential level, located in the Roddens Residential Unit, which is a statutory facility. This ensures continuity of care for patients closer to home. The Southern and Western Trusts have advised they have no specific designated ring-fenced delirium beds. However, they manage delirium patients within their bed cohort.
Frew.
Mr. Speaker, and I thank the Health Minister for answering a question that was put down as a written question and was to be answered on the 14th of April 2025. That in itself is a question itself. But I will ask the Health Minister, given the fact that there could be hundreds of people a year contracting delirium, with only 28 beds, only 6 within the NHS, how does this impact on waiting times in other wards, and how can the Minister be sure that people are being diagnosed correctly and receiving the appropriate pathway to care with regards to delirium or some of the other long-term conditions like Alzheimer's and the like? Minister.
Well, first of all, I absolutely apologise to Mr. Frew for the fact that the question was not answered in a timely manner. It is a fact that my department, I think, conducts something like 30% of all communications for all of the executive departments, so there is a lot of pressure on, and mistakes may be made, but that maybe explains, but it certainly doesn't excuse. In terms of diagnosis, I have to say to the member, I have every confidence in the clinicians and the specialists and the workforce who are conducting those diagnoses of patients. The shortage of beds is, of course, a concern to me, but that plays into the wider concern in terms of capacity gap compared to demand for health and social care services.
Danny Donnelly.
Thank you, Mr. Speaker. Thanks to the Minister for his answers so far. Could I ask the Minister whether his department has assessed whether the current delirium provision meets projected demand for an ageing population, and what changes are planned to address any gaps?
Well, I thank the member for the question. Work is always ongoing in trying to not only assess current demand but predict how that demand is going to go, and the answer tends to be it's going to go up. That it is in with a broader area of mental health challenges. Delirium, as the member I'm sure is aware, is a very specific disturbance of brain function. It's a state of sudden confusion and change in a person's behaviour and alertness, and that poses particular risks not only for the patient but perhaps those around them. So I would just assure the member it is very much on our list of areas to be mindful of, and to make sure that in terms of planning for capacity in the future, it's in there in a mix, as it were.
Anna Armstrong.
Thank you, Mr. Speaker, and thank the Minister for his responses so far. Minister, how does the Department ensure quality of care in the independent sector where delirium beds are contracted to?
I thank the member for her question, and obviously that would be an area of concern, particularly for the loved ones of people who are suffering from delirium. They might well have a preference for their loved one to be treated within the HSC rather than the independent sector. But I would reassure you that the Department does require very strict adherence to contractual standards, and that includes compliance with the RQIA, the Regulation and Quality Improvement Authority. They set guidelines for regular audits, and there's regular monitoring. Patient safety and continuity of care remain absolutely paramount.
That's it alone.
Minister, As delirium is often found in patients aged 65 plus, has consideration been given to extending the mental health liaison service to those in that age group in those particular trusts where presently the service is only available to those from 18 to 64?
Minister.
Well, I thank the member for the question. I was aware that age is a factor in terms of the prevalence of delirium. The exact request that he is making is one I'm more than happy to take away.
Minister, workers on the front line are telling me there aren't adequate delirium beds for the level of need, with only 6 beds in the Northern Trust. People are having to wait in acute hospitals for a considerable length of time before getting an appropriate bed to meet their needs. As our population ages, the pressures in this area will indeed continue to grow. Minister, in your opinion, does the current number of beds meet the current needs of patients, or what will you do in the short term to address this?
Thank you, Mr. Speaker. I would have to say the short answer is no. The number of beds is not sufficient to meet demand, but I have to say to the member respectfully, that is likely to be the case right across acute beds, right across all our health and social care trusts. The pressure has been on for a very considerable amount of time. It remains on 24/7, 365. It gets worse and it gets steeper and it gets deeper. And the demands on the workforce continue to rise. And I'm concerned about all of these things. But there's only so much you can do because there is a finite budget. And it is a very large budget, and executive members tell me all the time, I have just over 50% of the entire executive budget. I would prefer to look at these things in terms of objective, assess need. And if you do that, you would say you need more delirium beds and you need more workforce who can specialise in this area.
Mr. Kingston's not in his place. I call Ms. McElveen.
Question 4, Mr. Speaker.
I agree there is great benefit to early diagnosis for dementia. My department has been leading on work aiming to reduce the current waiting list. We've identified a number of system-wide measures which could help reduce delays. Each trust have sought to improve the current position through initiatives such as extra memory clinics and completing clinical validation exercises to ensure that the current waiting lists are as accurate as possible. In addition to this, there's been a sharpened focus on the education and recruitment of advanced practitioners into memory services to develop a multidisciplinary team approach, and that has been evidenced to aid with diagnosis. The Western and Northern Trusts have both employed an advanced nurse practitioner within their memory services. Furthermore, my officials advise active recruitment is being undertaken by those trusts facing particular challenges, especially vacant posts in old age psychiatry, which contribute to a capacity gap between the number of people on the waiting list and the number of people who can be seen at clinics.
Ms. McElveen.
I thank the Minister for his answer. Can I ask the Minister if he will commit to the gathering of sufficient data dementia diagnosis rates at a local level to enable comparison of dementia diagnosis across the United Kingdom as a first step to enabling an action plan to address what has become a postcode lottery of diagnosis in Northern Ireland, as well as attempting to improve our estimated diagnosis rate, which is around 55%?
I thank the member. The Regional Dementia Care Pathway sets out a vision for high-quality dementia services in a standardised, regionalised manner, emphasising early diagnosis, the development and introduction of resources, including easy-read guides and the Apps for Dementia Library for self-care and daily living support, have also sought to augment and support the guidance on offer to people with dementia and their families. The introduction of Encompass, which, as the member knows, is now live in all 5 geographic trusts as of the 8th of May last, means that our ability to trap data which will allow for population health interventions is unprecedented. It has never been before, and I very much look forward to tapping into that resource for the benefit of this cohort.
Sharon.
Gurlian, I thank the Minister for his answers thus far. Minister, could you outline how the Winter Preparedness Plan ensures that people who are living with dementia have a very clear pathway going forward to avoid unnecessary hospital placements?
Mr.
Well, thank the member for her question, and obviously there's huge concern, not least in this House, about winter preparedness and the additional winter demands that are going to come on the health and social care service, I would have thought my primary concern, and where I've asked for focus, is when people with dementia are presenting to emergency departments, because as a member will be aware, these are very bright areas and they can be very noisy areas, so it can be very disconcerting for somebody who's suffering that sort of mental rapid condition. As I said, it comes on very rapidly, and that is not an ideal environment for them. But I would like to assure the member that the workforce is very aware of these issues and will find whatever workaround they possibly can to deal with it.
Hunter.
Mr. Speaker, Minister, given the clear benefits of early diagnosis, will you commit to setting a target by which no patient will wait more than 12 weeks for a dementia assessment, or can you detail further some of the current waiting lists in Northern Ireland?
I thank the member. The current national target rate for diagnosis of dementia is 66.7%. Northern Ireland currently has a rate of 62%. So we reckon there are about 25,000 people living with dementia in Northern Ireland. In 2024, it was reported that 13,900 had a diagnosis. That was from NISRA, the Statistics and Research Agency. So the regional ministerial target for memory services, individuals should have access to the service within 9 weeks from referral. That doesn't include waiting times to diagnosis. The Regional Dementia Encompass Group are currently validating the data for this ministerial target under the System Oversight Measures Group. The key objective is to focus how to standardise and streamline data reporting across the region, because that's the way to shape service improvements and assist with future commissioning. And within that context, a priority will be assigned to reporting on the waiting times that people are having to endure before they get to be seen.
Doug Biddy.
Thank you, Mr. Speaker. Number 5, please.
The reset plan published the 9th of July this year is very clear. Transformation cannot simply be expanding hospital capacity. It has to mean changing how we deliver care, keeping people well for longer and supporting them in their own communities. In other words, getting health and social care as close to people's front door as possible. Prevention and community care are at the heart of the reset plan. 2 of the 7 strategic priorities are prevention and seeing the citizen as an asset, and secondly, investing in primary, community and social care. We're taking a whole system approach, by which I mean working with housing, with education and with the voluntary sector to tackle those wider health determinants and not just the symptoms that appear in hospitals. Prevention strategies like Live Better will enable people to take charge of their own well-being, and we're currently exploring a new initiative which we're calling This Is Our Health. In that, we want to create a public dialogue to encourage and empower the public to work with us as partners in managing their own health. And by March of next year, we'll have developed a neighbourhood model for primary, community and social care. We hope to start that on the 1st of April, but I should emphasise it will be a 5 to 10-year plan.
Mr. Beattie.
Thank you, Mr. Speaker, and I thank the Minister for answering. It's good to hear that whole system approach. But could I ask the Minister, community care is a critical component of our wider health and social care system. How are you seeking to ensure that social care will be better integrated to support people in their homes?
I thank the member. That's because I want to put an emphasis on community-based social care. It has to be a core pillar of this neighbourhood model. If we do it, it will ensure people can live independently in their own homes for as long as possible. And to do that, we have to tailor support to their needs. Social care teams will work with the GPs, with mental health services and the voluntary and community sector to enable care partnerships to be built and to reduce avoidable admissions to hospitals or longer-term care. My department is taking a range of steps to ensure social care has the capacity it needs. The neighbourhood model will directly support social care by embedding it within local multidisciplinary teams, shared planning and better coordination between health and social care professionals. The Reset Plan commits to improving information sharing, aligning care pathways and strengthening local partnerships so that people experience a seamless service.
McHugh.
Minister, how will you address the crisis in recruitment and retention within the independent community care sector in constituencies like my own, West Tyrone, which is of a highly rural nature?
Well, obviously, to make it a more attractive profession, you need to be paying the right salary. And again, I regret that I'm not in a position to move as quickly to the real living wage as I wanted to do. But it's also about the conditions in which people are working, the respect with which we show these people, and the idea that there is perhaps for those who wanted a career progression. And my department is in the process of finalising a 10-year strategic plan, and associated with that will be a 3-year delivery plan, drawing heavily on the recommendations of the Power to People report published back in 2017 and the subsequent consultation on the reform of adult social care which took place in January 22. The plans will prioritise a preventative approach to care and support, and the aim will be improving individual well-being, reducing the need for formal care, but also utilising community assets to achieve a more person-centred, sustainable social care system, and the hope would be that would be a much more satisfying way of doing business for the workforce.
Dan Dodds.
Thank you, Mr. Speaker, and thank you, Minister. And we did have a very helpful session on this with you in the Health Committee last week. But you're aware that transformation is also about transformation of hospitals, and you launched the Hospital Network consultation in October last year, and so far we have not heard the outcome of that consultation. Can you advise the House when we will hear the outcome of the consultation, and perhaps a little taster of some of the actions that might come from it?
Minister.
Well, I think we've got a two-part question there, and part two is certainly one I would have asked if I was her, but not one I would have answered if I am me, and I am me. So, yes, we have been taking a degree of time about this concept, and I think we are right to, because it is in its own right a very radical proposal, as I've said often in this House. I'm as guilty as anybody in wishing my local health and social care facility to provide every service and procedure that I may wish to avail of as a patient or a service user, and that simply isn't going to be possible. You cannot have an acute hospital at the end of every street. And so, once again, it is about, first of all, convincing the public of the concept that if they need a procedure, even if their local facility may do it, there may be somewhere else, some distance away, which has become a specialist area for that. And so it is absolutely in their best interest to travel. I know it is slow, and I could share the members' frustration, I guess, but actually it's really important to bring people with us. And what I would suggest to the members, you will see real movement in calendar year 2026.
Nick Matheson.
Mr. Speaker, what performance indicators will the Department adopt to demonstrate how transformation work is delivering tangible change rather than just stabilising a crisis?
So the member's talking about tangible measures for how transformation works? Well, we already do, because we have done quite a bit of transformation in terms of a primary level, multidisciplinary teams which are being rolled out, and I'm very grateful to the Executive and the Transformation Board for the 61 million which will enable Phase 2 over the next 4 years. So you get measures there in terms of the number of people who have accessed those MDTs. We have introduced rapid diagnostic centres for vague symptoms of cancer, both Whitehappy and Dungannon in the South Tyrone Regional. Again, the statistics come through for the number of patients who go through those processes. We have elective overnight stay centres. Again, the stats are there. And we have day procedure centres in places like Lagan Valley. And once again, the stats are there. So I don't want to be judged by saying, well, we have introduced rapid diagnostic centres, therefore that is a tick. It's a question of saying we have introduced rapid diagnostic centres and the outcomes have been X, Y and Z. And I think those outcomes are there to be assessed.
Matthew O'Toole.
Thank you, Mr. Speaker. Minister, further to that, indeed further to a lot of what we've talked about today, we've had the worst recently in terms of planning. We've now got, though we all want to see staff paid more, we've now got basically an overspend going into next year. This year we have the multi-year budget. We hope a once, almost in a generation opportunity to plan for and budget for change. Am I to understand that you are working with the Finance Minister so that we're going to have a multi-year budget next to health transformation? Will the public be able to see the type of resource that you and the Finance Minister are going to devote to sorting out our health system by the end of this year?
Well, first of all, I'm very grateful. I didn't hear or see the Minister on the BBC at the weekend, but I'm very grateful for his comments with regard to the savings that my department has managed to achieve. As I've said before, they are unprecedented in scale. I do very much look forward to a multi-year budget, not just because it provides a degree of certainty, as a member will be aware, but that certainty, I believe, can be used to be transformative in its own right. And that's where my focus is at the moment. Just for clarity, once we know what our budget is for next year, the first action will be to ring fence for pay. Because I don't want what has happened this year and what happened last year and what has happened in previous years to ever happen again. And I believe if I do that this year, and if God spares me, I do it this time next year, then I will have set a precedent that no future health minister will feel other than compelled to follow into future years.
David
After the pay comes the transformation. Because you can spend money on waiting lists, and it's right that we are bringing them down, but if that's all you do, then once the money's spent, the lists go back up again. So we have to do the transformation in tandem with tackling the lists.
As a friend of mine says, there's a comma, not a full stop. Sinead McLaughlin.
Question 6, Minister.
Thank you, Mr. Speaker. An independent review into children's social care services was completed by Professor Ray Jones in June of 2023, and that included commentary in relation to family courts and social workers' engagements with those courts. Now, work is being undertaken to address the issues identified in the independent review and respond to the recommendations made by Ray Jones. The management and determination of individual cases brought before the family court system is primarily a matter for the judiciary, because of course they're completely independent of government. However, I have recently received correspondence from and met with individuals who have drawn to my attention issues and concerns related to their reported experience of engagements with social workers and court guardians who provide reports to the family court system to assist the judiciary with their deliberations. The member is aware because she was in the room, and we have action points arising.
Thank you, Minister, and thank you again for taking the time to meet with my constituents and to hear just how serious and distressing their experiences have been with social services. Given the gravity of what you heard and your confirmation today that a review will now take place, can you outline when you expect that review to begin, what timeline you envisage for completion, and when families, more importantly, can expect to see meaningful change as a result?
Mr. Speaker, thank you. I hope the members are aware from recent comments that I've made in this chamber, I'm reluctant to start putting timelines because it seems to me that we are not world leaders in this department and in matching up to the timelines that we set. But it was very, very useful to me to meet those individuals with those lived experiences of private law proceedings and also their engagement with social workers and with court guardians. And some of it was not easy to listen to. But it's a lot easier to listen to it than to experience it and to go through it. So I've asked officials to provide me with advice. I've also asked for some options as how we could deal with these concerns. And once I get that advice, I'm going to think about how best these reports to family courts could be improved, because I do believe now they do need to be improved, and how the experiences of the sort of people I met with you and the involvement of court guardians in such court proceedings can also be improved. I'm going to stop short of saying it's going to be by such and such a month, but it's on the radar and I will not let it drop off.
Dillon.
And thank the Minister for his answers so far. Minister, just in relation to that specific issue around the reports what engagement have you had with the Justice Minister around conversations with the judiciary? Because very often the judiciary are directing social workers only to look at one element of a child's life. That is not satisfactory in terms of determining a child's entire future and the future of that child's family with them.
Well, I would say to the member, this was the first time that this issue has been put firmly on my radar. And so step one was to have the meeting and listen to the lived experiences. I've just outlined step two is to ask officials to take a look and come to me with some options. I think once I've got those options, that would be the appropriate time to reach out to the Minister for Justice, because this is very much in that Minister's bailiwick. But we work collaboratively as ministers and departments all the time, and it's the right thing to do. As I often say, there's very little one minister can achieve that we want to achieve as an Assembly and as an Executive. So I will be reaching out to the Minister once I've had the options paper from my officials.
Neil McAllister.
I think it is important to have that review and options for people who have had a negative experience. But sitting alongside that family court system and the issue of social workers is the Gateway team, and the Minister will be aware that across the Trust there's a disparity between transfer from the Gateway team to the day-to-day children's and family social services. Can the Minister confirm whether capacity is going to be increased with a number of social workers, or those in the multidisciplinary team that Ray Jones had advocated for in the next year, so that we can see those weights go down?
Thank the member for a question. Well, I can confirm that the majority of the recommendations in the Ray Jones report have been or are being implemented. She'll be aware some are cross-cutting, not least with regards to his proposal for an arm's-length body. But the Minister for Justice and I are pressing ahead. I think the Ray Jones preference was to include the Department of Education. That's not going to happen, certainly in the foreseeable future. So we are pressing ahead with that. But in terms of making specific promises or commitments to increase capacity, I cannot do that at this stage because I don't yet know what my budget is going to be for next year. I've outlined the top two priorities. Once we know what the budget is and what we need to commit to those top two priorities, then we look at everything else, and I hope the member recognises that as the only sensible way to proceed.
McGrath.
Question number 7, Mr. Speaker.
Minister.
Right, the South Eastern Trust remains fully committed to the installation of a new MRI scanner at the Down Hospital. This continues to be regarded as a capital priority for the organisation. It will significantly improve diagnostic capacity, and ensure timely access to high-quality imaging services for patients in that area. In preparation, the Trust has commenced work on a detailed business case that includes initial design work to enable rapid progress once funding is confirmed. I am committed to further progressing work across imaging services as soon as possible within the current financial climate. I would like the Imaging Academy. In December 24, I published a 3-year plan which recognised diagnostic capacity as a fundamental enabler of the 3 pillars of HSC, namely stabilisation, transformation and delivery.
Thank you very much, Mr. Speaker, and I appreciate what the Minister said about the development of this plan. It will save people having to travel great distances, especially if they are in conditions that mean travelling is difficult, and there is a need for this service. But we've been hearing about it for years and years. Would you have any timescale at all as to when this capital investment can be made so that the people of the east coast of Down and Lakeal area can have that service and not have to travel for it?
Well, first of all, I understand you've been hearing about it, A few days ago, I was up in Coleraine, and I was officially opening an MRI scanner in the Causeway Hospital. So sometimes things that have been talked about actually happen. And it's great. And now people won't have to travel from Coleraine to Antrim to get their MRI scans. I could try and tell you that capital projects of this scale and complexity require extensive planning, detailed design work and multiple layers of approval before implementation can begin. All I can say to you is I will try and deliver it for you as soon as I can.
Wigan.
Just following on from the previous question, I hope the people of Southdown do eventually get the good news that the people in the Northern Trust have got just recently. I was going to highlight the fact that you opened the new scanner in the Causeway Hospital. I think it'll stop 655 patients a year having to go to Antrim. On the Auditor General's report, Minister, earlier in the year, it produced a kind of devastating report on the state of CT scans, MRI scanners, scanning equipment in general across the north. Can you provide any update on investment on scans across hospitals across the north?
Minister.
Well, I can say to him that this issue is relatively fresh to me and of real concern, because if the equipment isn't there, then we have a very serious issue. What I can say is from 21-22 to the current year, more than 40 million of capital funding was prioritised for replacement imaging and diagnostics equipment and related enabling works across the whole of the HSE sector. Additional projects identified by the capital subgroup of the Regional Medical Imaging Board have been bid for as part of the Budget 2026 process, and that includes the MRI scanner for the Down Hospital.
Moving to topicals, Colin McGrath.
Much, Mr. Speaker, and of course all eyes are going to be on this week's budget in London, but with over half of the budget here being spent on health, and already we now see that 100 million has to be taken from next year's budget in order to pay our beleaguered staff what they are owed. What will you have to cut from next year's budget in order to pay for those?
Well, I understand the question from the member, but first of all, can I say we don't know what's in the budget, and we will find out on Wednesday, and then I think we will move rapidly, led by the Minister of Finance, to assess the implications for the budget for the Northern Ireland Executive. Now, in terms of the pay pressures and what the member is saying about next year's budget, to be very clear, I have not asked the Executive to overspend and dip into next year's budget. What I've asked is them to endorse the ministerial direction I gave some months ago to pay the health workforce. And that is happening. And that creates a pressure of £208.7 million, I believe. Let's call it 209. And I'm being promised up to 100 million from December monitoring, up to. That leaves potentially at least 109 million to be found. We have not finished trying to find savings this year. We will continue and continue until the 31st of March to try and find savings, but it is reasonable to assume when we get to the 31st of March we will not have balanced our budget, and that is a very serious thing. And I never wanted to stand here as a minister and preside over a budget that was broken. But it's better that we pay the doctors, the nurses, the allied health professionals, the workforce, and that's what we're doing.
McGrath.
Thank you, and absolutely we need to pay our staff, but if the budget books aren't balanced, if we've had to slash the money that was being made available for waiting lists to deal with that, and we go into next year's budget with trusts that have pared right back to the bone and will probably struggle to find any more savings, how perilous is our health service?
It would be perilous if we don't reform. And the determination of myself and the Permanent Secretary is to finally begin that long-awaited, almost fabled shift left. And we are now engaging with stakeholders. Earlier today I met the Eastern Federation, which, as you know, is a group overseeing a large number of GP practices. That's the third of such meetings that I have had. I think there is an appetite there for going to that neighbourhood model. And if you go to the neighbourhood model, then you're putting a focus on prevention to keep people healthy and early intervention when they start to get sick. And if you can do that effectively, then the number of high-cost procedures being carried out in our acute hospitals should start to come down. And as they come down, that releases money and that starts a flow. So I share the member's concern about next year's budget, but we don't yet know where we're going to end up this year. We don't yet know what next year's budget is going to be, and we don't yet know how quickly we'll be able to roll out the neighbourhood model. But I hope everybody's on the starting line for the 1st of April, For some, and for some processes, it will be a question of a 100-metre sprint. Others will be doing the 5K, some will be doing 10K. Who knows, some might even be doing the marathon to get there.
Neil McAllister.
Thank you, Minister. Minister, in your previous answer, you said that our staff, our healthcare staff, are important, and you named nurses and doctors and healthcare workers. So too are important, and you do agree, which I'm sure you will say again, is that domiciliary care workers, home care providers, are also essential to the running of our health service, but you did make the decision not to give them a living wage. So can I ask today around clarity on the percentage or number of independent home care providers who will not be receiving that living wage?
Well, I have said I am no longer able to fulfil my commitment to provide the real living wage from the 1st of September last. I remain committed to providing the real living wage as soon as possible. And there's no point in me saying, here's a new date, because who would believe it when the last date was broken into? Now, I have had several briefings, and I have heard Ms Shepherd from the independent healthcare providers contest what I told the committee last week. So I have asked for a solid report, and I've also invited Gillian Shepherd in to discuss it with me, which will happen on Wednesday.
Ms McAllister.
I do welcome the Minister for being transparent, and that you have asked for a report into that issue. Last week at Health Committee you said there was 70% were already in receipt of the real living wage. We have now heard through the media that it's over 80% who were not in receipt of the real living wage. So the question now stands is, did you make the decision based on knowledge of those facts, or from what you said at committee last week, that you weren't actually aware that 70% were already getting the living wage when you made the decision then not to pursue the living wage from September?
I made the decision to offer the real living wage from the 1st of December quite some months ago. It was on foot of some discussions with officials. In fact, it's so long ago, I think Peter May was the Permanent Secretary at the time, so it is a while ago. I wanted to do it, and I was told at the time it was possible. I think at that time we were projecting pay awards of 2.8%, and of course they turned out to be 3.6% and 4%, and I think that played into the unaffordability of going for the real living wage from the 1st of September. At the time that I committed to the real living wage, I was unaware of what percentage, if any, of what percentage of social care staff were being paid the real living wage by their employers.
Keith Buchanan.
Minister, only 33% of cancer patients has treatment started within the 62-day target time. So my question based on that is, will the Minister introduce a specific action plan designed to stabilise cancer waiting times?
Sure.
I think the short answer to that is yes. I mean, it is a matter of huge regret to me that this is happening, because it obviously impacts outcomes for patients. And when I first stood in this House, I said cancer, along with mental health and a couple of other issues, were going to be my main areas of focus during my time as Minister. Now, the member will know we have moved to that regional booking slot for assessments, which does introduce a regional standardised service, which is far too slow, and that point has been made forcefully by members in this House, and I accept it, but we are bringing it down, and we will continue to bring it down. And the next phase is about diagnosis and treatment, and trying to get a lot closer to that 62-day target. And I am talking to experts in that field, and they are coming up with really interesting and solid ideas.
Mr Buchanan.
So far, Minister, back in May, I think it was May in 25, you initiated the regional breast cancer assessment to reduce times there. When do you envisage that will meet the 14-day target?
Sir.
Well, I can understand why the member would want to have a date. I can't give him a date because these things are dependent on a huge number of factors. And when I say they're dependent on the workforce, it's not about productivity. It's about workforce staying healthy. It's about workforce perhaps going off on maternity leave. So there are factors which are beyond the control of the department or indeed any of the 5 geographically defined health and care trusts. But let me assure the member, there's no lack of effort from the workforce, there's no lack of focus from the trusts, and there's no lack of determination from the Minister.
Nick Matheson.
Thank you, Mr. Speaker. Can the Minister provide an update on the repurposing of Redwood Children's Home for longer-term placements for young people with learning disabilities?
Redwood, as I understand it, the issue, the member will keep me right here, was with the staircase. So I'm not actually aware of the current position with regard to whether the works have been completed. Just as a general point, the member, I'm sure, is aware that these institutions, these buildings, the use is really fragile. One unexpected young person with severe learning difficulties appears in an unplanned way from our point of view, and that can have a profound effect across our ability to provide residential and short break care right across the piece.
Mr. Matheson.
Thank the Minister for his answer, and I don't dispute the fragility of those services. My understanding is that Redwood was due to be ready for use in September. That was the target that had previously been suggested by your department. Would the Minister agree with me that when families who desperately need this provision, when they see those deadlines pass, that it erodes trust and it erodes hope? And what commitment can he give to the Assembly today that this will now be delivered without any further delay?
Well, I can certainly agree with the first half, because I have met some of the mothers, and particularly the mothers, on a not infrequent basis, certainly more than once. And I get it. And I also get their frustration that there is money available for short breaks, which is resource for us, so it can't be used for capital. And quite rightly, they don't understand that, because their mums are running a household. They have money, and they make choices with that money. And maybe they decide, I'm not going to spend so much on food this week because I need the money for my children's clothing or for school uniforms. So they don't have these solid walls between food, electricity, heating, clothing, transport. But we tend to do between capital and resource. And I think that is very much part of the frustration which I have discussed in some detail with them.
Peter Martin.
Thank you, Mr. Speaker. Can I ask the Minister what his department is doing to raise awareness of and support earlier presentation among women who are at risk from specifically ovarian cancer?
Yes, well, this would fall to the Public Health Agency, and I would assure the member that the Public Health Agency is particularly aware of this issue and the fact that there is this false belief among many, perhaps, that a test for cervical cancer will reveal ovarian cancer, which it does not. The one thing that the PHA is not doing at the moment is paid for advertising, and that is a reflection of the tightness in terms of the Department of Health's budget.
Mr. Martin.
I want to thank the Minister for his answer. Minister, my constituent, Stephen McCormick, tragically lost his beloved wife, Julie, to ovarian cancer. It took 2.5 years to diagnose that her symptoms were due to that, and she died within 1 year of diagnosis. However, once diagnosed, the service was absolutely exceptional. Ovarian cancer charities and survivors have highlighted delays in diagnosis and limited public awareness. To address delays, what consideration have you, Minister, made to shortening that diagnostic pathway for ovarian cancer?
Well, as a general rule, I would say to the member, I have asked officials to shorten every pathway to diagnosis and to treatment. And may I pay tribute to Mr McCormick, who is certainly on my social media on a daily basis and is very welcome to use my social media to try and raise awareness. And I'm very sorry that he lost his wife. And that is a common theme. Once you get into the health and social care service, you receive first-class treatment. So please do not be saying that the health and social care system is broken. But what is badly, badly damaged are the pathways in which you access that world-class treatment. And that will remain a focus of mine until I am no longer the Minister of Health.
Thank you. That concludes time for questions to the Minister of Health.